Hello, my name is Tara, and I'm a nurse at Connect Medical Clinic. And I am here today with Amber, and she is going to share with us her story of cervical cancer. Amber, I am so in awe of you right now for your courage, and I'm so grateful you are willing to tell your story. So, starting from the beginning, what symptoms did you have, if any?
I had bleeding in between my menstrual cycles and after intercourse. And then I had a change in the natural discharge.
Okay, all right. So, how did your doctor find cancer?
I went in for my yearly exam and mentioned my concerns. During the exam, my doctor found what she thought was a polyp on my cervix and referred me to another doctor because she thought the polyp was too large to remove in a clinic setting and didn't feel comfortable with it.
Mm-hmm.
So at the next appointment, he also thought it was a polyp, but it was standard procedure just to send the polyp in for pathology. And a couple of weeks later, he called me back and gave me the results of the pathology, and it came back as an adenocarcinoma cervical cancer.
Wow. So how did you feel hearing that diagnosis?
Deep down, I think I always knew it was probably cancer, but it was just devastating to actually hear those words. I was terrified and didn't know much about cervical cancer at that point. So of course I started Googling it, which just made the fear even worse.
Yeah.
But my whole life just kind of started flashing before my eyes, thinking, could this be the end? Could this be how I go?
Mm-hmm.
And at that point, I don't have any children. And I never thought I wanted children until that decision was just taken out of my hands.
Yeah, that must have been so hard. How was the cancer treated then?
I went down to the Mayo Clinic in Rochester, Minnesota for my treatment. I underwent surgery to have my fallopian tubes, uterus, and cervix removed, along with 3 nearby lymph nodes. And they did testing during my surgery to see the extent of the cancer. And at that point, they did not think the cancer had gone all the way through my cervix. And so they didn't think I needed any further treatment. But as the weeks went by, my doctor called back with the final biopsy results. And at that point, he told me that the cancer had actually gone through my cervix. And so he took it in front of a cancer board and just to see what their thoughts were, because at this point he thought that he might have to go back in for a second surgery to do a radical hysterectomy where he removes the ovaries, more lymph nodes, and some surrounding tissue.
Yeah.
But the cancer board thought that that probably wasn't necessary just because the cancer wasn't found in the lymph nodes that they had removed. So I was pretty lucky with that.
Yeah.
And then my follow-up just kind of consisted after that of checkups every 3 months with my doctor and for the first 3 years. And then I'm at every 6 months for 2 additional years. And this August, it'll be my 5-year mark for being cancer-free.
That's wonderful. That's wonderful. It's such an amazing story. And I'm sorry that happened to you, but I'm really grateful that you've had almost 5 years now of being cancer-free. And I guess in closing, what would you want to make sure that other young women, they know about cervical cancer?
I just want them to be aware that, when I was young, there wasn't a vaccine for HPV, so I wasn't given that option, but now there are other options and there is a vaccine available that they can get. And just want to say that if they are having symptoms, don't feel embarrassed to talk to somebody or to go to the doctor and just get looked at, because in the long run, it can save their lives and make it so that they can have children down the road if they're not ready at this point.
Yeah, exactly. And it's a powerful message to take control of your sexual health through preventative measures like the HPV vaccine and regular pap tests. Amber, I know this took incredible bravery for you to tell your story, and I'm so grateful you have. I know you're going to help many young women seek out the preventative health. that they need. So thank you so much for coming to us in January during Cervical Cancer Awareness Month and Cervical Health Month. And we are all going to keep you in our thoughts and prayers that you will forever be cancer-free.
Thank you.
Yeah, thank you. For more information about cervical cancer, you can visit cdc.gov/cancer/cervical. And if you would like to talk about anything related to sexual health, you can reach us through our text line for sexual health questions at 701-840-6280 or call our clinic at 483-9353. Thank you so much.